In this video, we'll talk about sinus blockage and the surgical procedure that we use to unblock it. One of the most common operations I do is endoscopic sinus surgery, where one looks to restore the function of sinuses by opening up the natural channels that are blocked. We usually do this operation under general anesthesia. We plan it as a day surgical procedure, and generally speaking, with the instruments that we have and the good visual aids that we have with the endoscope and the camera system, we're able to identify where the sinuses are blocked and open them up. The most common risks of surgery are usually controllable, even in theaters, and they usually circle around things like infection or bleeding. We generally give antibiotics during the course of the operation, and sometimes when you go home, especially if we find that the sinuses are actively infected. We also encourage you not to blow your nose, as this may trigger a bleed, which generally can happen within the first 10 days of the surgical procedure. Because patients feel blocked up, and just because of the way the nose reacts to any surgical trauma, we always offer you some decongestants with nose rinses to help with the healing process and to reduce the congestion so you're less likely to blow your nose. The sinuses are surrounded by vital structures, but these are very rarely, if at all, breached because of the increased use of imaging like CT scans, and in some cases we have other aids to help us keep within the confines of sinuses. So it's generally a straightforward procedure done as a day case, and most surgeons tend to use dissolvable packs, so you're able to go home rest assured that it will heal without much problems with bleeding. Generally speaking, when we allow you home, we expect to rest for the first 2 weeks because that's the most tender period. So during that first 2 weeks, we expect to relax, and thereafter gradually start getting yourself to able to go to work. You can work after 2 weeks, but I generally tend to ask patients to take it easy from going to the gym for a further 2 weeks so that they're able to heal properly without the risk of triggering a nosebleed.